have to move on to the next section. We're a little behind schedule, but it's okay. We have great panelists here. So our next speaker is Dr. Kathie Erwin, and pardon me as I pull up your bio here, Dr. Erwin. Dr. Erwin is a professor, faculty member of the Divine Mercy University, and she's a licensed mental health counselor, national certified counselor, national certified gerontological counselor, and diplomat in mental health counseling and Fulbright specialist. As a master field traumatologist with Green Cross Academy of Traumatology, she has served in Trinidad, India, Romania, and Ukraine. Dr. Erwin is the author of 7 professional counseling books, of which Group Work for Aging Adults, 2nd edition, generated international interest, leading to guest faculty invitations for Nordmag Gerontology Intensive at University of Iceland and Mexican Association for Counseling and Psychotherapy. And the work they're doing over there at Divine Mercy University is really fantastic. It's a wonderful Catholic psychology program, master's program, doctoral program. So Dr. Erwin, thank you so much for joining us.
Thank you for the invitation. I'd like to focus a little attention on all of you for a few minutes, because I know you're so focused on your patients. Let me give you something to take with you into the battlefield, and that's where we are right now. You're in battlefield medicine. We're in battlefield psychotherapy. That is where we are, because the unseen risk of COVID is not just the virus, it's the fear, the frustration, and the isolation that is really beginning to wear so hard on everyone. And I know that you're seeing it in your patients. And I love hearing how so many of you focus on really listening. We call that sometimes the ministry of presence. And we do this a lot when we go out into field situations internationally or even domestic disasters. We sit down and do what's called psychological first aid, but you know what it is? It's what you're doing. It's the ministry of presence. It's really listening, really connecting, giving that time. And that's what all of you are doing. But I know it's coming at a cost, because it cost us too. And the cost is called compassion fatigue. I've been there. Some of you are there right now. We'll all be there again, because we care. That's how Dr. Charles Figley defined this, the cost of caring. And there is a cost to what we do. Now, the Lord called us and He knows we can handle it. But sometimes we need somebody to come alongside of us while we are handling this. We say sometimes the example of when you get on a plane, you get the directions to put on your oxygen mask first so you can help someone else. That's what I'm talking about with compassion fatigue. There is, as the teenagers say, no shame in the game if you experience compassion fatigue. What we have to do is reach out to each other, because in this situation, there's no end. This is what we would call psychologically a shared traumatic event. We sometimes think of those in terms of hurricanes, natural disasters, things that have a reasonable end in sight. We don't have one right now. And in a shared traumatic event, there is a cycle. In the beginning, we see what we've seen here, and it's kind of a blessing, and I'm really excited about it. People helping each other, people caring about each other, people checking on neighbors who can't get out, people going to the store for them. This is wonderful. But unfortunately, humans wear out. They get into that traumatic situation, and we see a cycle about a shared traumatic event where at some point people are just tired of it. And I'm beginning to hear that from folks, and you probably are too. And they just stop that whole interactivity, and they just want it to be over. And at that point, they're having to go through what we're all going to go through. And that's literally the grief of the loss of the life we had before COVID. How will it come back? How will it be? Only God knows that answer. Will it be better? Will it be worse? I don't know. I do know that it'll be different. And hopefully we are going to be different people going into that as well, different people in good ways. But in that shared traumatic scenario, there is that period of time, which usually lasts in natural disasters a matter of weeks to months. Not sure about this one. It's a whole new thing. And then we begin to come back up in the cycle and find new ways to interact. Interaction is so important. And that's where we have to really encourage others. And I hear you all doing this, talking about what is safe, what isn't safe, dispelling some of the rumors. I really appreciate listening to this because there's a lot of information, but there's also a lot of misinformation, and that frustrates people. People are also missing being together, particularly at key times. I had the opportunity to pray with one of my students who is a priest on the front lines, and talking about how difficult this compassion fatigue is as he works with families who are about to bury their loved ones, and the impact that has on him and the impact that has on families not being able to be there and be together. This is a whole new realm of compassion fatigue for us all. And I hear you talk about, I wish all medical professionals would speak this way, about how you're listening, how you're taking the time. Sure, you're busy. Sure, there's more people that need you. And even over telehealth, I teach online as a university professor. This is my world. It's new for some of you. That alone has to be frustrating. You're used to having that face-to-face contact, that person-to-person reaction. And I'm guessing some of you are probably a little frustrated by that. And that's a normal reaction. It's okay. Just realize that your very presence, whether it's by phone or by video, is a comfort in and of itself to your patients. So you are not failing to give them yourself. You're just giving them yourself differently. So you are doing all of those things. You know, Romans tells us about do not be conformed to the pattern of this world, but be transformed by the renewing of the mind. Well, the pattern of this world is pretty difficult right now. And so we're looking to set that pattern in another kind of way. We're all going to learn a lot about how to do our professions differently. None of us were trained this way. Now, maybe we have a little advantage in a sense in the field of mental health counseling because we're used to dealing with a lot of changes, maybe more than some of you are in dealing with changes. And I, working as a field traumatologist with our Center for Trauma and Resiliency Studies at DMU, we're all over the world in international places where we feel upset, out of the norm, don't have anything to hold on to. So in a way, I guess we were a little bit trained for this. But when we come home and we see that feeling all around us, it's emotionally shaking, I have to tell you. Please don't think that mental health professionals have it all together, because I'm here to tell you right now a deep, dark secret. We don't always. We can be as fearful and as frustrated as some of you may feel, and some of your patients feel, and some of our patients feel, to be completely honest. I do want to tell you, though, there's some things that we can do for ourselves, for you, and I want this to be for you. Is first of all, find a good partner, a good buddy, someone else in the field. And some of you have this, like through Catholic Medical Association, through your organizations, someone you can sit down and look in the face and say, tell me why I need to go back in tomorrow. I'm just tired. I'm worn out. I'm spent. I'm drained. And you can say that honestly. That doesn't make you a bad professional. That makes you an honest one, because we all feel that way at times. And having that person that you can speak to, or be that person in your organization who talks about compassion fatigue openly and says, you know, we're going to go through some of these periods because of how much we are on duty now. Let's talk about it. Let's be open about it. We do that when we go out in field traumatology all the time. We even have a little process we call the tap out. If we see another colleague who's really getting just way down the rabbit hole of compassion fatigue, we tap them and say, take a walk. And then the other person steps in. I remember the first time that was done to me. And I went out and I left my students and I took a walk and I fussed all the way. I said, excuse me, Lord, I know what I'm doing. In fact, this is an older couple. I'm a gerontologist. No one can do this better, blah, 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 blah. And as I walked a little further, it hit me. I was falling down the rabbit hole of compassion fatigue. I was getting over-involved. I was losing my perspective. My colleague was kind enough to graciously show me that. And I came back with a whole different view. Sometimes we have to be able to do that with our colleagues. We have to be able to step in and help. And most of all, receive that help with the goodness in which it is given, because that is true. So I want to show you a couple of ways you can take an emotional break in your day as medical providers and healthcare administrators. Sometimes the simplest things that we train our students and our clients can be the most powerful. And here's one I want to mention to you. You know that when we are intense, frustrated, fearful, stressed, we don't breathe well. And that's not good for the whole body or for the brain. So we sometimes give a simple little exercise to our clients and we say, imagine that you have gone into a beautiful arboretum where there are fragrant flowers, your favorite kind of flower. And there's even a birthday cake because it's a special event. And so reach over and pick one of those flowers. Smell it deeply, really breathe it in. Breathe in that smell, breathe in that smell, breathe in that smell. Fill your lungs with that smell, that imaginary smell. Hold it for a few seconds. And then turn around to that birthday cake and blow out the candles very slowly, exhaling all that breath out. Breathe in the smell of beautiful flower. Blow out the birthday candles. Now I know that sounds really simple, but you know what you just did? You calmed yourself. Because when we are intense, fearful, frustrated, we don't breathe well. We breathe shallow, maybe even hyperventilate. Something that simple. You do that 1 or 2 times. You can do that literally when you're riding up the elevator to go to the next floor to see the next group of patients. And all of a sudden you realize, wait a minute, I feel a little more calm than I did. It's that simple. Please take that thought with you. You can do that when you're in the car. You park and you're getting ready to go in to see people and you know it's going to be difficult. Calm, center yourself. It really does make a big difference. And something else I want to share with you. God gave us a healing power within our own mind. That's why Romans told us about the renewing of the mind. He wouldn't tell us something we couldn't do. Here's some ways we can do this. Here's some ways you can do this to calm yourself with all the work you're doing. We talk about visualizing a safe place. Maybe it's a place you've been. Maybe you love to ski, you love the beach, you love to hike. Some place that's beautiful, that's calming, that's serene, whether it's a place you've gone or a place you would like to go. Just step away from everything that's going on for a few minutes. And I would suggest just closing your eyes if you're willing to remove all those distractions around you. Maybe you even have to walk outside and sit in your car to do this. I've done that plenty of times from my office, just to get away from the distractions. And as you think about that safe place in your mind, really see it, really vividly see it. What do you see? Speak it out loud if you can. What do you smell there? What can you touch there? Is there something you can taste there? Think about that place. Think about that calming. And then see the presence of God with you, holding your hand, touching your shoulder, saying, well done, good and faithful servant. And then come back. Come back to where you are. Honestly, that's a short break. And I assure you, because I've had to do this many, many times, even between patients, I've had to do this. You come back more peaceful than you were before. These are just simple things you can do and you can share with folks. Realize that frustration will happen. I've heard some of you talk about the frustrations of medical care and other issues and getting help for folks. Some of you are new to telehealth. That's going to be its own frustration. But the bottom line is this, and I tell my students all the time, where God calls you, He will equip you. He will never send you out to fail. He's called us now for such a time as this to work on Zoom. You weren't trained for that. You didn't plan for that. That wasn't what you wanted, but you know what? We're here. We're doing it. And we're doing it because this is the option. This is the day that the Lord has given us and the method He's given us. And I praise God that we have these telehealth abilities. Imagine how terrible this would be if we did not have even that. So thank you for all that you do. We at Divine Mercy University and at the Center for Trauma and Resiliency Studies would love to partner with you in any way. Dr. Benjamin Keys, our Director of Center for Trauma and Resiliency Studies, is a world-renowned trauma specialist. My specialist is in trauma with older adults. Where we can help you at Divine Mercy University and many other specialists on our staff, please call us. We would like to be here to serve you in the name of the Lord that we all love, and we know beyond a shadow of a doubt, will bring us through. Thank you for allowing me to be part of your wonderful conference.
Thank you so much, Dr. Erwin. And I think the mental health and that compassion fatigue, especially even for people not directly working in healthcare or dealing with people impacted by coronavirus, COVID, it is just this kind of silent weight that does affect all of us. And so thank you again for all of your insight here. Next